My head. Why does my head hurt so much? It feels like it's going to explode.
Felix, it's me, Hootie. Open the door.
Hootie, I don't feel right. My head is pounding, and I'm seeing two of you.
Can you say my name clearly?
Who? Hootie.
Felix, these signs are serious. Time is very important. I'm calling emergency services right now.
Okay, I trust you.
See how quickly it can happen? Now let's talk about the warning signs you should never ignore. Hello everybody, I'm Hootie Nurse, and I want to talk about the signs and symptoms of a stroke. A stroke occurs when the blood supply to the brain is interrupted. In about 80% of cases, this happens due to a blood clot or a blocked artery. Very early stroke warning signs: persistent headaches, visual changes such as blurred or double vision, sudden vision loss in one or both eyes, intermittent numbness or weakness, especially on one side of the face or body, difficulty speaking, dizziness or balance issues such as trouble walking in a straight line or unexplained falls, short-term memory problems, for example, forgetting common words or tasks, or getting lost in familiar places, changes in mood or behavior, such as increased irritability, anxiety, or depression, unusual fatigue. Signs of stroke. Stroke can happen suddenly and cause the following signs: sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking, or difficulty understanding speech, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance, or lack of coordination, sudden severe headache with no known cause. The importance of quick action. Stroke treatments work best when the stroke is recognized and diagnosed within 3 hours of the first symptoms. If someone doesn't arrive at the hospital in time, they may not be eligible for these treatments. If you suspect someone is having a stroke, act fast and do the following test. F. Face. Ask the person to smile. Does one side of the face drop? Arms. Ask the person to raise both arms. Does one arm drift downward? Speech. Ask the person to repeat a simple phrase. Is the speech slurred or strange? T. Time. If you notice any of these signs, call emergency medical services immediately. Note the time when the symptoms first appear. This helps healthcare providers determine the best treatment. If you found this video helpful, make sure to hit that subscribe button and support us. Learn, prevent, stay healthy. See you next time.
Amazing, Hootie. Your tips are so easy to follow and really make a difference. If you want to stay strong and healthy like me, don't miss out on Wello Quest.